Welcome back, everybody. Ready for another deep dive? This time we're going into the fast-paced world of emergency medicine, where, let's face it, every second counts.
Absolutely.
We're going to be focusing on how paramedics try to make sure they don't make mistakes when they give patients medication.
Yeah,
And our source for this is a guide that's actually made for experienced paramedics out in the field.
right.
So we're talking about real deal, expert level stuff here.
That's right.
When I first heard about this topic, I thought, how complicated can double checking be?
Yeah.
But oh boy, was I in for a surprise.
It's a lot more complex than people think. In emergency medicine, we're always under pressure.
Right.
Every second matters, and if you make even a small mistake, it can snowball into something really serious for both the patient and the paramedic themselves.
Okay, so let's get specific here.
Yeah.
For our listeners, can you paint a picture of what could actually happen if a paramedic makes a medication error in a super intense emergency situation?
Okay, imagine this. You have a patient who's in critical condition.
Okay.
They need treatment like right now.
But then a medication error happens, and that could delay that super important treatment,
Oh, wow.
which then leads to even more problems or could even make the situation worse.
That's a scary thought.
Yeah.
Yeah.
And for the paramedic, it's not just about that one moment. The emotional weight of knowing they made a mistake,
Yeah.
the potential legal issues, and what it could mean for their career, it's a lot to deal with.
It's intense. You really start to understand how important every little detail is. So the guide talks about mindful double checking. What exactly does that mean? And how is it different from a normal check?
Think about it when you're rushing. Your mind kind of goes on autopilot.
Mm,
You might look at something but not really see it.
right.
Mindful double checking is about being super focused.
Mm,
It's a process where you check the prescription, make sure the dosage is correct, and this is crucial. Get another healthcare professional to look it over too.
So it's about really thinking about what you're doing, not just going through the motions. It's like having an extra layer of safety. Exactly. Two pairs of eyes are always better than one, especially when you're dealing with medications that can have such a big impact. But even when you're careful, mistakes can still happen.
Yeah, that makes sense.
And that's where standardized protocols come into play.
Right. I've heard about these protocols like
Mhm.
SOPs and checklists,
Yeah.
but aren't those just a bunch of rigid rules that stop paramedics from being creative and adapting to different situations?
I can see why people might think that,
Yeah.
but it's not really like that. Think of them more like a roadmap.
Okay.
They help guide paramedics through each step when they're giving medication.
Got it.
This way, everyone's doing things the same way, which lowers the chances of missing a step.
Right. Especially in a crazy environment.
Exactly. But they're not set in stone. These protocols are always being updated based on the latest research and what we learn from actual cases. It's about finding a balance between having structure and being flexible.
So it's more about having a framework for safety, not blindly following rules. Okay. But even with the best systems in place, we're all human. We make mistakes. What about something as simple as making sure you have the right patient? It seems like in a busy ER it would be easy to mix people up.
You'd be surprised how often that happens. Even in places where things are supposed to be controlled, you could have two patients with similar names
Right.
or similar conditions. And that's a recipe for disaster.
Yeah.
That's why paramedics are really strict about using two ways to identify a patient.
Okay.
They check the patient's full name and date of birth, and ideally compare it to their medical records or ID bracelet.
Wow. So no guessing, even if you think you know the patient.
Yeah.
Speaking of things that can easily be overlooked, what about keeping your workspace organized? I mean, we've all been there when we can't find what we need in a mess. But imagine dealing with life-saving medications in that kind of chaos.
Oh, absolutely. A cluttered workspace is like an accident waiting to happen.
Mm.
Paramedics are trained to keep their area super organized with clear labels on everything. It might seem simple, but in a high-pressure situation, those simple things can be lifesavers.
It's fascinating how such small things can make such a big difference for patient safety. Now, one thing that really stood out to me in the guide was how much emphasis they put on educating patients.
Right.
I wouldn't have thought that would be so important for preventing medication errors.
It's something a lot of people don't think about, but giving patients the right information is crucial. Imagine being given medication and having no idea what it is, how to take it,
Mm-hmm.
or what side effects to watch out for. It just creates confusion and could lead to mistakes.
That makes sense.
Paramedics take the time to explain everything clearly, and they encourage patients to ask questions to really be involved in their own care.
So it's about treating patients like partners, not just someone who receives care. So what happens when a patient is moved from one place to another, like from the ambulance to the hospital? How do paramedics make sure the information about their medications gets passed on correctly?
That's where something called medication reconciliation comes in. It's like putting a puzzle together. Paramedics go through the patient's current medications, compare them to any new prescriptions, and look for any potential conflicts.
Damn.
Detailed documentation is really important here. It creates a clear record for everyone who's taking care of that patient.
It sounds like a lot of work, but with really important implications. You start to appreciate just how much information paramedics have to deal with in such a high-stress job.
It is a lot. But that's why these systems are so important. They add layers of safety to make sure errors don't slip through the cracks. And there's another part of error prevention that's really important, learning from near misses.
Near misses, you mean when something almost goes wrong, but it's caught just in time?
Exactly. Let's say a paramedic almost gives the wrong medication but catches the mistake at the last second.
Right.
Instead of ignoring it, those near misses are treated as valuable lessons. Paramedics are encouraged to report them without being afraid of getting in trouble.
Oh, that's good.
That way the team can figure out what happened and make changes to prevent it from happening again.
So it's about focusing on improving things, not blaming people. That sounds like a much better way to create a safer system.
It is. And it's becoming more common in healthcare because it acknowledges that everyone makes mistakes. The goal is to build a system that minimizes the chances of those mistakes harming patients.
I like that approach.
Yeah.
But even with the best training and protocols, technology is playing a bigger and bigger role in preventing these kinds of errors.
Right, definitely. We're seeing amazing advancements in technology that are changing how we think about medication safety. Take barcode scanning, for instance. It's like having an instant digital check that makes sure you have the right medication and the right dose.
Right.
And then there are electronic medication records, or eNAMRs.
Okay.
They're a game changer because they keep track of everything electronically, which gets rid of all the mistakes that can happen with handwritten notes.
So it's about using technology to make things more efficient and reduce the chance of human error. But in a field like emergency medicine, which is constantly changing, it's not just about using new technology.
Yeah.
It's also about staying up to date with the best ways to do things right.
Absolutely. Paramedics are committed to lifelong learning. They go to workshops, seminars, and even get special certifications to make sure they're always on top of the latest advancements in medication safety.
And that's impressive.
It's not just about individual knowledge either.
Yeah.
Building a strong culture of safety within the entire healthcare team is crucial.
Okay, so let's unpack that. What does it actually mean to build a culture of safety in a place as intense as an ER?
It's about creating an environment where everyone feels comfortable speaking up if they see something that could put a patient at risk. And they can do that without being afraid of getting in trouble. It means encouraging people to talk openly about errors and near misses so the team can learn and make things better.
So basically creating a space where people feel safe to point out problems before they become serious.
Yeah, exactly. It's about moving away from blaming people and instead creating a sense of shared responsibility for patient safety. Everyone from paramedics to nurses to doctors needs to feel like they can be part of the solution.
I can see how that would take time and effort to build that kind of trust.
Let's shift.
It doesn't happen overnight.
You're right. It's an ongoing process that everyone on the team needs to buy into. It's about making safety the top priority.
It sounds like a much more proactive approach, and in the end, probably a much more effective one.
It is. And it's gaining popularity in the medical field because it acknowledges that we're all human. We all make mistakes. The key is to create a system that minimizes the impact of those mistakes on patient care.
That makes a lot of sense. Before we move on, I think it would be helpful to take a look at that summary table in the guide.
Yeah.
It lays out all the key strategies for preventing medication errors that we've been talking about.
Great idea. Let's go through them. First, we have those mindful double-checking procedures, where the focus is on making sure the prescription, the dose, and the patient information are all correct. And ideally, getting another healthcare professional to double-check, too.
Absolutely. Then there's using those standardized protocols, those roadmaps,
Right.
to guide how medication is given and make sure everyone's doing things consistently.
Exactly. Next, we have verifying the patient's identity using two identifiers like their name and date of birth before giving them any medication.
Right. No guessing allowed.
Exactly. Then there's keeping that workspace organized, everything clearly labeled and clutter-free.
And we can't forget about educating patients,
That's right.
making sure they understand their medications, how to take them, and any potential side effects.
Absolutely. Empowering them to be active participants in their own care.
Right. And then there's medication reconciliation,
Yes.
carefully checking and documenting all of the patient's current medications every time they're moved to a new care setting to prevent any bad interactions.
That's a crucial one. And remember those near misses? They're valuable learning opportunities, so it's crucial to create an environment where people feel comfortable reporting them and then using that information to improve safety protocols.
Absolutely. And of course, there's the amazing power of technology,
Right.
using things like barcode scanning and ENRs to cut down on manual errors and add extra layers of verification.
Exactly. And lastly, but definitely not least, is promoting that culture of safety, where open communication, teamwork, and a shared responsibility for the patient's well-being are at the forefront. It's amazing to see how many different things go into preventing medication errors in such a demanding field. It really shows how dedicated and professional paramedics are. They're constantly working to improve patient safety. But we've covered a lot in this first part of our deep dive,
We have.
and I think it's time for a little break. We'll be back soon to continue exploring medication error prevention in emergency medicine.
Sounds good.
Welcome back. It's fascinating how these error prevention strategies really show you just how complex emergency medicine is.
It is. You know what I'm finding interesting? It's not just about following a bunch of rules.
Right.
It's more about having this mindset of always being on alert, like a detective almost.
Yeah.
Always thinking ahead, what could go wrong, and then actively trying to prevent those things from happening.
That's a really good point. And it's not just about individual paramedics being careful. It's about the whole healthcare system working together.
Exactly, like a safety net to
All right.
catch mistakes before they reach the patient.
Right.
You talked about systems earlier. Can you give us some specific examples of things within the system that might actually increase the chance of medication errors happen? I mean, things that go beyond what one person does.
Well, one big one is how medications are stored and given out. Think about it. If you have meds with similar names
Okay.
or packaging
Hmm.
and they're right next to each other, it's easy to grab the wrong one.
Especially in the ER, where things are so hectic.
Exactly. It's like when you're at home trying to find the right spice jar and they all look the same.
Right. But obviously the stakes are way higher in the ER.
Absolutely. That's why a lot of hospitals are using technology like barcode systems now.
Oh yeah, I've seen those.
They add an extra layer of checking, making sure the right medication is going to the right person.
It's like a computerized double check.
Exactly. Another system problem is when communication breaks down between healthcare providers. Let's say a patient's medication list isn't passed on correctly from the ambulance to the hospital.
Oh, I see.
That missing information can cause some serious problems.
It's like that game of telephone where the message changes as it goes around.
It is. And that's why having clear, simple, and standardized communication is so important.
Makes sense.
It's not just about what you say, but how you write it down, too. If everything is documented correctly and consistently, everyone has the right information.
That makes a lot of sense. Going back to that guide we've been talking about, I'm really curious about this idea of a culture of safety. It sounds good, but what does it actually look like in a busy ER?
A true culture of safety means everyone feels comfortable speaking up if they have a concern,
Okay.
without being afraid of getting blamed or punished. It means encouraging people to talk openly about errors.
So they can learn from them.
Exactly, and improve the way they do things.
So it's about creating an environment where people feel safe to point out potential problems before they become big issues.
Exactly. It's about moving away from blame and focusing on working together to keep patients safe. Everyone, paramedics, nurses, doctors, all need to feel like they can contribute to solutions.
That makes sense, but I imagine it takes a lot of trust and communication to get to that point. It's
Yeah.
not something that happens overnight.
You're right. It takes time and commitment from everyone. It's about shifting the mindset so that safety comes first, always.
It sounds like a much more proactive and ultimately effective approach.
It is. And it's gaining popularity in healthcare because it recognizes that we all make mistakes.
Right.
The important thing is to have a system that minimizes the chance of those mistakes affecting patients.
We've talked a lot about the role healthcare providers play in preventing errors, but what about the patients themselves? What can they do to be more involved in their own care?
Patients have a huge role to play too. One of the most important things they can do is be active participants in their healthcare.
What do you mean by that?
They need to ask questions, speak up if they have concerns, and make sure they understand their medications.
So being an advocate for their own health.
Exactly. Don't be afraid to speak up. Patients should feel comfortable asking their healthcare providers about the medications they're prescribed. What is this medication for? How much should I take? When should I take it? Are there any side effects?
Yeah, those are good questions.
It can really help prevent errors. After all, it's the patient who's actually taking the medication.
Right.
And they're in the best position to notice if something seems wrong or if they have unusual symptoms. They should feel comfortable telling their healthcare providers about those things.
So it's a two-way street. Healthcare providers need to be clear, and patients need to ask questions and advocate for themselves.
Exactly, it's a partnership. When patients are actively involved, it can really reduce the risk of medication errors. Now, we've been focusing on emergency medicine, but I'm wondering if these strategies can be applied to other areas of healthcare too.
That's an interesting question. Do these principles work in other settings?
Absolutely. The core principles of medication safety are the same everywhere. Hospital, clinic, long-term care facility,
That all applies.
double checking, standardized protocols, clear communication, a culture of safety. These are all essential for preventing errors no matter where you are.
So it's not just about emergency medicine, it's about creating a culture of safety across the entire healthcare system.
Exactly. In fact, a lot of these strategies were first developed in other healthcare settings and then adapted for emergency medicine. It's all about sharing best practices and learning from each other.
That's great to hear. It's inspiring to see how much dedication and collaboration there is in this field. Everyone working together to make healthcare safer.
It really is.
Mhm.
And it's a continuous process. As healthcare changes and new technologies emerge, we're always finding new ways to improve medication safety.
It makes sense.
But with all the protocols and technology, it's important to remember that behind every decision, every action, are real people dedicated to caring for others.
That's a really important point. It reminds us that this isn't just about abstract ideas. It's about real people making decisions that have real consequences.
Exactly. And their work is making a huge difference in the lives of so many patients. We've covered a lot in this episode, from the steps involved in double checking to the bigger picture issues that can lead to errors.
Yeah, we have.
But there's one more crucial aspect we need to talk about: real-world examples of medication errors.
And the lessons we can learn from them.
Exactly. Stay tuned. We'll be back soon to dive into those real-world cases and see how they've shaped the way we approach medication safety.
We're back and ready to wrap up our deep dive into medication error prevention. We've talked about the strategies, the systems, and the mindset that help make healthcare safer. But we all know that even when everyone's trying their best, mistakes can still happen.
Right, that's just the reality of any complex system, especially when you're dealing with people's lives. That's why it's so important to learn from those mistakes, to figure out how they happen and how we can prevent them from happening again.
So let's get into some real-world examples. Imagine a chaotic ER. A patient comes in with severe chest pain. Every second is critical. The doctor orders a medication to be given through an IV. But in the rush, the paramedic grabs a vial that looks almost identical to the right one and gives the patient the wrong drug.
That's a classic example of a look-alike, sound-alike error, and they happen more often than you'd think.
So even with all the protocols and double-checking in place, a simple mix-up like that can still slip through.
Unfortunately, yes. It really highlights how important clear communication is, both when you're speaking and writing. Even small differences in pronunciation or handwriting can have big consequences. It also shows why we need systems that make it harder for human error to happen, like keeping look-alike medications separate or using barcode scanners to verify everything.
It's about having multiple layers of protection, right? Because we know people aren't perfect, especially in high-stress situations. Okay, let's look at another scenario, this time from the patient's perspective. A patient's being discharged from the hospital after a long stay. They're given a new prescription for a blood thinner, but the instructions are unclear. The patient's overwhelmed and unsure and ends up taking the wrong dose.
That example shows how crucial it is to educate patients properly. They need to understand not just what medication they're taking, but also why they're taking it, how to take it, and what risks there might be.
So it's about giving them the tools and the confidence to ask questions, to speak up if something's not clear, and to be their own health advocate.
Exactly. It's a partnership. Healthcare providers need to explain things in plain language, avoid jargon, and make sure the patient really understands. Written materials should be clear and easy to read, to reinforce those verbal explanations.
These examples really show that errors can happen at any point, from prescribing to dispensing to administering and even to just understanding the instructions.
And there can be many different causes: human error, system failures, communication breakdowns. The important thing is to learn from these mistakes. Every error, whether it causes harm or is caught in time, is a chance to improve.
So instead of blaming people, it's about analyzing what happened, figuring out the root cause, and making changes to prevent it from happening again.
Right. And that's where a culture of safety is so important. It means creating an environment where people feel comfortable reporting errors, discussing near misses, and offering solutions without being afraid of punishment.
It's about shifting from a culture of blame to a culture of learning.
Exactly. And when we do that, we can turn those mistakes and near misses into opportunities to make the healthcare system safer and more resilient.
This deep dive has been really insightful. We've really gotten into the nitty-gritty of medication errors, what causes them, and what strategies are used to prevent them. We've seen how even small things can have big consequences and how important it is to constantly learn and improve.
Absolutely. And even though we've been talking about emergency medicine, these ideas can be applied to other areas too. Think about other fields where the stakes are high. Aviation, nuclear power, even driving a car.
Right, it's about being vigilant, anticipating potential risks, double-checking assumptions, and building systems that make it less likely for errors to happen. It's about understanding that humans will make mistakes, but doing everything we can to reduce the impact of those mistakes.
It's about creating a culture of safety that goes beyond any one profession. It's about all of us taking responsibility for keeping ourselves, each other, and everyone around us safe.
We've all learned a lot from this deep dive. I think the takeaway message for our listeners is this. Striving for safety is a continuous process. It requires being aware, working together, and always learning from mistakes.
And it's a worthwhile effort, because when we make safety a priority, we're not only protecting ourselves, we're creating a world where everyone has a better chance to thrive.
That's a great note to end on. Thanks for joining us on this deep dive. Until next time, stay safe, everyone.
You've been listening to the Learning Podcast, a production of Metanesta. Remember, learning is a journey. One step, one insight, one skill at a time. We'll see you next time. Keep learning, stay curious, and as always, be awesome.